So the final topic that we're going to talk about now is healthcare. This comes up, to be honest, more frequently since the coronavirus pandemic. So I think our health is more in the forefront of our minds these days. And again, I think Jen and Yvonne, you are the people to answer this question. Could you give us an overview of the healthcare system and how it works in Germany?
Yes, we can keep it short and sweet, or try at least. It again depends. Oh my God. But the one thing for sure is that you do, by law, need to have healthcare in Germany. That is the fact. Like, it doesn't matter if it's public or if it's private. You cannot be residing in Germany without any healthcare at all. So that is one very important thing to point out. And whether it's public or private, that really highly depends on your situation. Are you single? Are you with a family? What is your salary, etc., etc. But if you are public or privately insured, again, like, all these deductions get taken away before you even get your salary. So that's part of like the expense of your gross salary. So it's not like you get money in the bank and then you pay your health insurance. It gets like deducted before you even see the money. And whether to find out if you're actually better to be publicly or privately insured, we have a partner called Feather Insurance. They have a very good service in English where they assess case by case whether what's the best option for you. Not whether who pays them the most money, but more or like what is the better financial option for you. Because the public healthcare system is very awesome, but you cannot apply if you earn after a certain threshold. And the private healthcare can be also quite expensive. So it's like a lot of kind of like things I need to consider, many variables that I cannot answer in this webinar.
True, it's a big topic, isn't it? But I think the main takeaway for a lot of people would be that it's fairly good quality compared to many parts of the world.
Absolutely, yes.
And so is the rest of the kind of social system in Germany. So if you get a job in America, yes, your taxes will be lower and your net salary will be higher, but you then have all the headaches to deal with yourself, with your social securities and your healthcare. In Germany, it's almost like conveniently done for you by the government.
Yes. And I can only say and vouch that, at least because again, my threshold or my comparison bar is very low. Guatemala, I don't need to, like, it seems that I talk very bad about my country, but have to admit that certain things don't work so well. So in Germany, I've been very happy with the healthcare system. Really, it's you can go to any doctor whenever you have a problem. It's not, you don't have to always think, oh, but I'm going to pay extra or I'm going to do something if you're publicly insured. So I've been very happy. I've been able to get pretty much whenever I'm sick or whatever, I'm able to go to the doctor without any issues, and things work out pretty well.
Mm-hmm. Good to know.
Just one more addition, you actually already need health insurance for your visa. So it's a mandatory requirement to come to Germany per se. Without the health insurance, you won't get a visa. And like Jen said, the type, maybe you don't have a choice. It really depends on how much you earn. And that is already setting the baseline whether you will go public or private, most likely.
Sure.
And am I right in saying that some companies, when you move to Germany, actually give you health insurance as part of a package? I know it probably varies depending on what company you work with, but is that something sometimes they do, or is it something that you have to do on your own?
So that would be a very, I would say, US approach, that the company pays your health insurance. In Germany, your company, the employer always pays 50%, and you as an employee always pay the other 50%. But you don't see any of that money. That's what Jen said. That's what we said in the beginning. From your gross salary, approximately 40% will be subtracted, and part of those 40% are social contributions such as health insurance, as well as taxes, of course. So you basically just need to sign up with a health insurance company, and the payment of it gets handled through your payslip.
Mm-hmm. Nice and simple. It is a lot of money, but when it's organised for you and it's to a good quality, I think it's going to be worth it for most people.